Hey everybody, Jason here, Tailored Physical Therapy and Wellness. Hope you're doing good. If you had the opportunity to try those first two videos, hopefully you found them helpful. Please don't hesitate to reach out to me, good, bad, or indifferent, regarding your thoughts on those. We'll love to hear from you and try to help you out any way that I can. So I've received a couple requests to do a video regarding total body stretching. So what I'm going to show you today are going to be some stretches from the head all the way down. And by no means are these the only kind of stretches you could do. There is a vast array, so many different kinds of exercises you could do regardless of whatever body part you're talking. These are just some exercises I found that could be helpful, hopefully for you. So let's give them a shot and see if you like them, okay? To start, I want you to have a seat anywhere you like, in a chair, couch, make yourself comfortable. And we're gonna start with a stretch for your neck here. So what you're gonna do is I'm gonna start for a stretch on the right side. I'm gonna take my left hand, put it right on the top of my head, and I'm gonna feel the top of my right ear with my fingertips. And I'm gonna pull straight to the side until I feel a little stretch right on the right side of my neck. Once I feel that, we're gonna pull straight down. So that stretch should shift from directly to the side and start going a little bit towards the back. Okay. If you want a little bit more of a stretch still, you can rotate your head slightly to the left. And where you should feel this is right about here on the back right side of your neck. And we're going to hold that for about 30 seconds or so. We're going to do one time on the right, one time on the left, and then we're going to do it again. With these stretches, don't be aggressive with it, just nice and easy. Go to what's comfortable for you. When you come off of the stretch, don't just immediately let go, let your head snap back. Just slowly come off of it. As with the first two videos, if you've had any recent surgeries or any kind of medical history that you feel maybe you should seek out approval from your doctor before doing these stretches, always a good idea. Instead of listening to me count to 30 seconds multiple times today, we're just going to use the timer. So, here we go. Right side, stretch. So you're going to take your left hand, put it on top of your head, feel the top of your right ear, pull it to the side until you feel a little stretch, pull straight down until you feel a little stretch, and then you can rotate a little bit to the left. Time is running. Again, you want to feel that on the right posterior or back side of your neck in this area here. Just nice, light, easy stretch. Halfway home. Beautiful. And then when you come off this stretch, nice and easy like I did. Don't just immediately let your head go back to the normal position. Might be just a little stiff, a little uncomfortable. That'll work its way out relatively quickly. Once you feel like you're ready, let's do the other side. So right hand on top of your head, feel the top of your left ear. Again, pull a little bit to your right till you feel a gentle stretch. Go down, little rotation to the right. Time's running. Now, if you're like me, your neck is probably stiff. You don't have to go very far. So again, just a nice, comfortable stretch. Don't try to rip your head off. And these would be good stretches you can do if you have a desk job at work. You don't have to sit down and do this by any stretch. No pun intended. You can do this standing as well. Good. Nice and easy. Gently move your head around side to side. Again, might be a little sore coming off of that, but it should resolve quickly. Let's go back to the right one more time. Sideways, down, slight rotation away. Away from the side being stretched. In about 5 seconds. Good. Again, nice and easy to come off of that. Good. As you come off of these stretches, if you haven't done these before and your neck is nice and stiff, you might feel your neck kind of creak, snap, crackle, and pop. If it's not painful, it's nothing to worry about. One more time on the left side. Good. 5 more seconds. Very good. Okay. So what we're going to do next is we're going to move toward your thoracic and lumbar spine here. So I want you to lay on the couch. You can do this in bed. You can do this on the floor if you can get up and down from the floor safely. So I'm going to start on my left side. We're going to do this a couple different ways here. So kind of slide close to the edge of your bed or your couch. Just make sure you're not going to roll off. You're going to bend your knees comfortably. What you're going to try to do is keep your knees right where they are, and you're just going to roll back like this as far as you can comfortably go, and then come back. So we're only going to hold this for maybe 5 seconds or so. What you can do is you can take this arm of the shoulder that's on top, and you can open up and take that all the way across. So obviously this wall is going to be in my way here, but if I were to roll over, it would look like this. So you try to take the top shoulder down towards the floor wherever you comfortably can. If it feels okay with your shoulder, you can extend that arm and try to open up your chest here, get a good stretch. However, if this bothers your shoulder, if you just don't have good shoulder, something feels funky, no big deal. Just keep your arms across your chest like you're giving yourself a hug. And you can just roll back and forth like that. So I'm going to roll back over so you can see me. Start on your left side, or whatever side you want to start on, doesn't have to be your left. And then I'm going to start just because the wall's in my way with my hands across your chest. I'm holding my head up just because I don't have a pillow. You don't have to do that. Make sure you have some support here for your head. You don't have to hold your head up. Okay? So legs stay relatively quiet. Roll back as far as you can comfortably go. A couple seconds, and then come back to where you started. We're going to do 10 of those. That was 2. This would be a good one to do kind of first thing in the morning if you feel really stiff when you get out of bed. You don't have to do 30 of these by any stretch. This time pun intended, just joking. 10 to 15 reps is fine. It's nice and easy. Do a couple more here. Good. And now we're going to go to the other side. I'm just going to flip over again so my back isn't towards you, but you can just roll to your other side. And we'll do about another 10 or so. Good. 3. Go 2 more. Good. So let's roll to your back. We're going to stick with the spinal range of motion theme here. This time you're going to have your knees bent comfortably. Try to keep them relatively close together. And then you're going to do basically the same idea, rotating side to side, just with your lower half here. So now we're focusing more on your lower back. Again, this would be good to do in the morning when you wake up if you feel like you have a stiff back in the morning. Just nice and easy, side to side with your legs, working into the range of motion just to get things moving. So we've probably done 5 or 6, so we'll do a few more. Again, you don't have to do 30 of these. You can do 10, 15, 20, no specific number until you feel like you've done enough, things are feeling good, and that's fine. Good, we'll go one more here. Okay. So now we're gonna move towards your glutes here and your hamstrings. So we're going to combine 2 of them. So you can do this 2 ways. You can keep both of your knees bent as you pull one leg up, so it feels better on your back typically with your other leg bent. Or if you want more of a stretch, straighten one leg and then you're gonna cradle the other one like so. If you have a hard time reaching behind your thigh with your knee straight or bent, you can take a towel, stick it behind your leg, and then that can give you a little leverage to pull like so. So I'm gonna do this with my leg straight. You're gonna pull one leg up comfortably, hold for about 10 seconds or so. Might feel a little stretch here. Good, and then switch. Good, just nice and gradually pulling that knee towards your chest. Again, you can keep your other leg bent. In doing so, you'll find you'll be able to pull your leg further. That's just because of what it does to your pelvis as you do that. But it might feel better on your back, so do what feels comfortable. About a 10-second pull. And we're gonna do about 5 times. This is number 3. Good. Let's go 2 more. Now, if for whatever reason you don't like having your hands behind your leg like this, or you don't have a towel close by, you can also just reach right on your knee. You don't have to go under it, you can go on top. Again, whatever feels comfortable for you. Good, so we'll call that 5. So next, we're gonna add a part to that. So again, you're gonna cradle your leg. You can keep the other one straight if you want more of a stretch, or bend it up based off your comfort. This time you're not gonna pull all the way back. You're gonna pull, if your hip is relatively 90 degrees or so, you're gonna hang out right about there. And you're gonna take your leg and just kick it up, try to pull your toe down, feel a good stretch back in your calf, back in your knee, back in your hamstring. Go about 10 to 15 seconds or so. Good, and then you can switch. Again, just cradle your leg, kick your leg up to where you feel a nice stretch, pull your foot back, get a little stretch in your calf, back of your knee. Good, about 10-15 seconds, and then relax. And we'll do that 3 to 5 times. Call this number 2. Good. I'm going to do these next couple with my legs straight. And if you're watching, you can tell I can't quite get my leg as straight. When I straighten my other leg, I'm not stretching. And that's just because I'm really tight back there. Got to start practicing what I preach when it comes to stretching. I'll be the first to tell you. Good. 2 more. Again, just like with the neck, nice and easy. You're not trying to necessarily lock your leg out and stretch with all your might, especially if it's the first time or the first time in a long time. Just nice and easy, just a nice comfortable stretch. Okay, you don't need to try to get your leg over your head. Last one. And about 10 to 15 seconds. I might have shorted the other one. Good. Then last one. Okay. Excellent. Hopefully you're starting to feel nice, loose, and limber. We're going to stay in this position For this next stretch, we're going to work on stretching your glute, but mainly what's called your piriformis, which is a small muscle that lies deep into your glute here. So there's a few ways we can do this. One way is to lay on your back, cross one foot onto the other knee. And then you can push your leg down like so to try to get a good stretch in your butt there. And then from here, you can also take your hands and pull your knee kind of towards your opposite shoulder. So in this case, I'm doing my right knee and I'm pulling it towards my left shoulder, and you should feel a good stretch right there. And then we'll do the same thing with the other side. And then I'm going to show you that you can also do this sitting up if it feels a little bit better for you. So let's do a set like we are on your back. Push your knee down. I'm going to start on my right. Hold for about 30 seconds or so. It's about 15. Good, and 30. And then you can pull your knee in, wrap your hands around the outside of your knee, gently pull towards your opposite shoulder. You should feel a nice little stretch in your right glute or your left glute, depending on the leg you're doing. Good, let's go about 10 more seconds. Good. All right, let's go and switch to your other side. We'll go into the one where you push down. This is called a figure 4. Again, trying to get that stretching sensation in your glute. You might feel a little bit in your groin. That's okay, as long as it's not a sharp, stabbing, piercing pain like we've talked about before. Let's go about 10 more seconds. Good. And then go ahead and pull that knee towards your opposite shoulder. Now, I'll be honest with you, this stretch I like more pulling my knee across your body. The reason why we do both is your piriformis rotates your hip both internally and externally, depending on how much hip flexion you have. So that's why I like to have patients do both directions. Good. So the other way you can do this stretch, like I talked about a second ago, is you could do this seated. So you just, same idea, you could cross your leg over like this, and you can kind of push down as you lean forward. This may not be as comfortable as the other way. Some people like this one better. Again, to each their own. And then in the same position, you can pull like this. Good. And then we can switch sides here, push down. This stretch, the figure 4 sitting, is a little bit more awkward for me. I prefer the other way. And then pulling up this way. But again, same idea, whatever you feel comfortable with. Laying down always feels better. Alrighty. Oops. Okay, I'm going to show you guys 3 more stretches here. All right, the next stretch we're going to do here is for your hip flexors. So what you want to do is you want to get down onto the floor. So you're down onto one knee. And what you want to do, a lot of times if you've done this stretch or seen this stretch, you will see people kind of really arch their back and try to lean forward like this. You don't need to lean all the way back like this to get a good stretch there, okay? To get a good stretch there, all you have to do is tilt your pelvis backwards, okay? It's kind of tricky to do when you're in what's called a half kneeling position, okay? It just takes a little practice. If you feel your pelvis right here, you put your thumb kind of right towards the bony part of it, That can give yourself a little cue if you're kind of tucking your butt underneath you as you do that. But if you do that first, as opposed to leaning back, that'll help you get a much better stretch, okay? So put your hand on your pelvis just for a little feedback. You want to tuck your butt underneath you, push your hips forward, and then from here it's just a little lean forward. Shouldn't have to go very far, and you'll get a good stretch right there across the front of your hip. And we're going to hold that as well for about 30 seconds. Good, and you can slowly just kind of inch into it as that stretch gets a little bit less. You can creep into it, about 10 more seconds. Good. Go ahead and switch sides. Again, feel for your hip. Do that little pelvic tilt here. Try to tuck your butt underneath you. Rock forward. Feel that good stretch across the front of your hip. Good idea to do this next to a couch or a bed someplace, or a chair that you can use your hands to help yourself get up if you have a hard time getting up and down from the floor. About 5 more seconds. Good deal. We do one more time on each side here. Again, butt underneath you. Feel your hip if you need to get that feedback. Once you have it, little rock forward. And then as you're doing this stretch, don't hesitate to rest your hands on the bench, couch, chair, table that's next to you. That's totally fine. Good. Last time, switch sides. Butt underneath you. Lean forward. So this would be a good stretch also for those of you who have jobs where you sit a lot for the majority of the day. As we sit more and more, as the days go on, our hip flexors, which actually starts in your lower back, the major one, and goes to the front of your hip, gets nice and short and can lead to not only hip pain, but a lot of times lead to back pain. So if you're having back pain and you're able to do this stretch, you might get some relief there. Okay, good. Carefully go ahead and return to your feet. We're gonna go over 2 more. All right. So you can find any wall to do this on. This is gonna be, again, for your back. You wanna start so your arms are relatively straight, kind of inch your way back with your feet. And all you're gonna do is push your butt back, chest to the floor. Keep your legs relatively straight, as that'll help you get a nice stretch for your hamstrings here. And then as you come up, try to push your hips towards the wall as you lean back. So you're pushing your butt back, chest to the floor. Try to keep your legs straight so you can get also a stretch to your hamstrings. Come back up, let your hips fall into the wall as you lean back. We're gonna do that 10 times, okay? Here we go. Couple seconds on the hold as you rock back. Couple seconds on the hold as you lean forward. Good. Think about elongating that spine as you push your butt back and then butt to the wall. Good. You can do this anywhere. Good way to get that back moving if it feels stiff. Good way to get a good stretch in your hamstrings. Good. Let's go about 3 to 4 more here. Good. Last one. Good. Okay, let's do, sorry. All right, let's do one more stretching exercise. So that's gonna be for your chest here. Okay, so what we need to find now is a doorway, or you could use a corner of a wall, whatever feels comfortable for you. I prefer a doorway. Okay, so for this stretch here, what you want to do is you're going to put your arms up like so on the door frame. You can have your elbows about shoulder height, or if that's too uncomfortable, you can drop them down some. And all you're going to do is just step forward, open up your chest, and come back. Okay, so for this stretch, you just, again, need to find a doorway. You can use a corner of a wall, but I feel a doorway works a little bit better. You're going to start putting your arms up like this on the door frame. If that's too uncomfortable for your shoulders, slide your arms down a little bit. You can even go here. So it'll look either like this, but if that's too uncomfortable rather, slide them down some. If that's still too uncomfortable, bring your arms down here. With this stretch, again, just like the stretch we did for your hip flexors, a lot of times you'll see people like really lunging and going forward into the stretch. That's not necessary. This is all about the setup. So what you want to think about doing is, whether you have your arms here, here, or here, is you want to take your shoulder blades, you're going to pinch them back together. Okay, it doesn't have to be aggressive, but pull your shoulder blades back and lift your chest up. And then from there, when you lean forward, you shouldn't have to go very far. Okay, so it'll look like this. Arms up. Again, find that comfortable spot here or down, whatever you feel is good for you. You want to have your shoulders back just a little bit. Lift your chest up, 1 foot forward, and just nice and easy lean into it. Does not matter what foot goes forward. And then come back. And we're going to do that for 30 seconds. And you should feel that stretch all across here. Here we go. Good. Got my shoulders back, chest up, little lunge forward, nice little hold. Good, hopefully getting a nice stretch across the front of your chest here. Okay. Good. Shake it out, do what you got to do. I'm going to do this next one with my arms down, just so you can see what that looks like. It might feel a little bit better on your shoulders if you do it like this. But same idea, shoulders back, chest up. Here we go. Okay, good. Hopefully you felt that stretch across your chest as well. So that'll do it for the total body stretches for this video. Hopefully you find some benefit from this. As with any exercise you've been shown that we've gone over, modify accordingly. If 20-30 seconds is too long, do 10 to 15, maybe just do an extra rep. Again, just nice and easy with these. You don't have to be aggressive with it, but hopefully you get some benefit from this and it helps you out. Again, any comments, questions, concerns, please don't hesitate to reach out to me. Talk to you guys soon.